Today I want to talk to you about stroke and how we identify stroke and how we can help you or your loved ones if you're in the middle of having a stroke. We use the memory rhyme "be fast" as a way to help you identify those signs and symptoms of a stroke. B stands for balance. If you or your loved one suddenly experiences a loss of balance, where your walking becomes unsteady or the coordination of your arms or legs goes unsteady, that could be a sign of a stroke. E stands for eyes. If you have impairment of vision, where you lose vision in one eye or the other, or experience sudden blurring of vision or double vision, that could be a sign of a stroke. F stands for face. If you or your loved one suddenly experiences weakness or drawing of your face on one side compared to the other, that could be a sign of a stroke. A stands for arm. If you suddenly develop weakness or numbness or clumsiness of the use of your arm, such that you're dropping objects or having difficulty with the use of that hand, that could be a sign of a stroke. And although we're focusing on arm, that also applies to your leg. S stands for speech. If the way that you pronounce your words, understand the words, or find the right words to say becomes altered, that could be a sign of a stroke. And finally, T stands for time. The time to call 911. We know that when you come to the emergency department in an ambulance that has already notified the medical teams that someone with a suspected stroke is coming, that allows us and the rest of our care partners to provide you the quickest, most efficient care in a time when we can save the most brain cells. If you notice yourself or any loved one or a member of the public experiencing one of those symptoms, please do not come by car. Call 911, have them be brought to the closest emergency department so that the right tests and the right treatment can be delivered to you or your loved ones, therefore allowing them the highest possibility of reducing brain damage and getting back to a functional life.